Hi everyone. So in this series wherein we are discussing about various aspects of table viva, I had promised that we shall be taking a discussion after instruments to another important topic on table viva, and that is going to be contraception. Now contraception often forms a very significant part of not just your exams table viva but also a part of your practical life, especially if you are going to be taking obstetrics and gynecology as your future branch. So there are several contraceptive methods, and I have decided to pick few of the most important and the most used ones. And I don't think I had a better contraceptive agent to start off these discussions than this one. We have all seen this, and we have all read about this. This is Mala N. So Mala N, this is a Government of India supplied oral combined contraceptive pill. This is Mala N, which we get for free in most of the civil hospitals. We also get a Mala D, which you get for somewhere between 3 and 4 rupees. It is the price that is listed on the internet is 3 rupees 65 paise. So technically 3 rupees. But this one, that is Mala N, is the one that you get for free in almost every hospital, every civil hospital. So what is this? This is a very typical combined contraceptive pill. I say combined because it contains, don't look at this line, this white tablets, these white tablets over here, these contain estrogen and progesterone, which is why we call them combined. They have to be taken orally, which is why we also call them oral combined or just oral contraceptive pills. Now, which pill is this? So over here you can read in the title that it is levonorgestrel and ethinyl estradiol. Now what are these? Now we define these OC pills, or we classify them under few names or under few categories. We call them either low dose or high dose, or we now even have very low dose, and we give them a term of generation of OC pills. Now the low and high dose depends on what is the dose of estrogen that is present in this, whereas the generation depends on which progesterone is present in this one. So to give you an overview, first starting about the estrogen part of it, low dose या high dose 50 microgram से अगर ऊपर रहेगा, then we call it high dose, which is technically something that we don't get too often. And the reason we don't get it is because it used to cause a lot of hypercoagulability, which was leading to increased chances of DVT. So we don't get them now. What we get nowadays are low dose pills. So low dose pills are anything that have a concentration or that have a quantity of estrogen at less than 0.3 microgram. So the one that I have now is ethinyl estradiol over here, and you can see that it is given that it contains ethinyl estradiol in the dose of 0.03 milligram, which is equivalent to 30 microgram. We also nowadays get very low dose OC pills in which the dose is less than 20 microgram. The lowest effective dose is said to be 10 microgram. So anything above 10 is said to be effective. Although the effectivity is only in terms of contraception, it will not afford all the non-contraceptive actions of it. So this one is a very classical low dose OC pill. Talking about the generation, we have generations of progesterones, various generations. We have 4 generations. So how are those generations made? Those generations are made on the basis of their androgenic action. So starting off with generation 1, 2 and 3, the androgenic activity reduces. So basically generation 3 progesterones have the least androgenic activity, whereas generation 4 progesterones have an anti-androgenic activity. So basically antagonize excessive androgenic action in the body. So this is a very classical second generation low dose OC pill because it contains levonorgestrel. Levonorgestrel is a type of second generation progesterone. The first generation progesterone, an example is norethisterone and norethindrone, whereas in second generation we have norgestrel and levonorgestrel. In third generation we have things like desogestrel, which is something that we use very commonly in women who have premenstrual symptoms or in women with endometriosis. We also have etonogestrel. It is something that is present in those newer rings, those contraceptive rings that we get, and also implants that we get for combined contraceptive agents. And fourth generation, which has an anti-androgenic action, it is comprised of drugs like dinogestrone or drospirenone. Now there is one more drug or one more progesterone compound, that is cyproterone. Now cyproterone, according to a lot of literature, is a fourth generation OC pill because it has an anti-androgenic action, but I would like to debate this point because in most of the chemistry literature, it has shown that the chemical structure of cyproterone is very much similar to first generation progesterone. So despite its action being one of anti-androgen, it has to be remembered that it is a first generation progesterone and not a fourth generation one. Fine. So how do we use this? You see that there are 28 tablets. You have 7 over here and 4 over here, so it makes it 28 for 28 days cycle for a female. And you see that there are white tablets in this 3 rows, so 21 white and 7 black tablets. Those black tablets are the ones, black color unko diya gaya because they signify iron, black stools as well. So these are all iron tablets, whereas the one that you find over here, these are your combined OC pills. How do you give them? You have to ideally start it between any day between day 1 to day 5 of menses, and it has to be continued for the next 21 days. After the finishing of these white pills, you see that behind here, you will see that they have even given a direction. Key starting on day 1 you take this tablet and then you go like this, then you go below, then you come again here, and then finally at the end of it you take those black tablets in the last 7 days of your cycle. How does this work? Now by giving this exogenous estrogen and progesterone, you are disrupting your FSH and LH secretion by negative feedback mechanism. Now that will lead to anovulation. So the major mechanism of action of this is inhibition of ovulation. But even individually, there are several more actions. By what I mean by individual is estrogen and progesterone individually. So ये तो estrogen का काम हो गया, negative feedback से inhibiting FSH and LH. But what about progesterone? So progesterone has several actions. It begins with thickening of cervical mucus, so that will prevent the penetration of sperms or rather the entry of sperms into the uterus. You have endometrial thinning. Now progesterone is something that leads to endometrial atrophy, so it leads to thinning of your endometrium, which makes the uterus very non-conducive for the implantation process of the embryo. It also reduces the motility of your fallopian tubes, so the sperm cannot reach the ovum cannot come to the ampullary part where it is going to get fertilized, and the embryo which is eventually formed will not be able to reach into the uterus. So all these actions are made up by the progesterone component of it. So both of them act individually as well as they work together to inhibit ovulation. So a very good drug. Now this was about the contraceptive action. One of the major problems while taking this is that women tend to miss their pills. I mean, it is a very common thing, compliance, especially if they've gone out somewhere and they've not taken an extra pack of this, then it might so happen that you might miss the pill. So what is the problem? So if you miss 1 or 2 pills, basically दिन में एक pill लेना रहता है, and if you miss 1 or 2 of them for 2 days, it's still okay. You can resume it the moment you remember that you have missed a pill, and then from 3rd day you can continue taking it the way it is, and then you complete the cycle the way it is. The problem begins if you miss it for 3 or more days. When you miss it for 3 or more days, you have to remember that your ovulation is now going to happen. There is a good chance that your ovulation might happen. Your body has escaped the effect of contraception. So the first thing that you have to advise them, you have to use some alternative contraceptive for the next 7 days once you again start taking these. So when you start taking these, any other contraceptive includes a barrier contraceptive like condom, or if you have already had coitus, then take an emergency contraceptive, something like I-pill or unwanted 722, which is basically levonorgestrel. So take that. Apart from that, this is for the first 2 weeks of your cycle. If you miss a pill in the 3rd week after ovulation possibly might have occurred in your body, then in that scenario you need to remember that you are at a greater risk of conceiving, which is why if you're missing 3 or more pills during the 3rd week of this, basically जब 3rd line चल रहा था, then you continue taking these pills, but you do not take the black pills, you do not take the iron pills, you directly start the next cycle के white pills without a single day's break. So basically if you're missing it in the 3rd week, it indicates that you are going to have a progesterone withdrawal, which is why you do not need to wait for this cycle, for this strip of iron pills, and you directly start a new strip without taking these. You discard the black pills completely. This was about the contraceptive uses. What are the non-contraceptive actions, which in fact form one of the most important usage factors for this one. So first of all, the use is, it can if you're taking this for 21 days and then you stop taking it and you take these iron pills, basically it is causing an artificial progesterone withdrawal in your body. So that will ensure that you're getting proper cycles if you're taking this properly, if you're compliant with this. So this is used for regularizing menstrual cycles, especially in women with PCOS in whom ovulation is anyway affected. So this regularizes menstrual cycles. जिनको भी irregular cycles होते हैं जिसकी वजह से उनको inconvenience होता है, this is protected, or this is going to help them in that. Apart from that, because progesterone causes endometrial atrophy, it ensures that your heavy menstrual bleeding due to various reasons, it can be endometrial hyperplasia, it can be adenomyosis, all these things, it is going to be reduced significantly. Even in patients with fibroids, the endometrial lining is going to be thinned out, which will reduce heavy menstrual bleeding and abnormal uterine bleeding. Apart from that, remember that whenever you are taking any combined OC pills, the progesterone action is going to be much more superior and stronger than your estrogen action, which is why with that predominant progesterone action, your endometriotic spots in your body, for women who have endometriosis, they are going to be atrophied. So dysmenorrhea that occurs because of endometriosis is going to be significantly reduced by these pills. Apart from that, even for women who are having post-menopausal symptoms or menopausal symptoms, in them the estrogen is the deficient part. You give them estrogen, but if they have a uterus, then they are at a higher risk of developing endometrial cancer. So in them you have to also give progesterone. Now the good estrogen and progesterone which are given for hormone replacement therapy are very expensive. We call them conjugated estrogens and progesterone, so they are very expensive. So you can give this, which is a free measure, or which is a free drug to them, though they are not that effective, but they do good enough job to alleviate the symptoms of menopause in these women. Apart from that, the fourth generation OC pills like drospirenone and Dynogest, they also have an anti-androgenic action. Because of that anti-androgenic action in women who have PCOD and also have hirsutism in them, it can act well to reduce hirsutism and signs of hyperandrogenism. That said, what are the contraindications? So the contraindications, first of all, remember that there is an estrogen component in it. The estrogen is going to lead to increase in the number of coagulation factors that are being produced by your liver. So in women who have any other risk factor for hypercoagulability or who have history of deep vein thrombosis, these are contraindicated in them. A state of hypercoagulability includes your pregnancy and puerperal period until 42 weeks after delivery. So you have to avoid giving it during that period, basically during pregnancy and the next 6 weeks after delivery. It is completely contraindicated. Apart from that, because this is metabolized in the liver, you have to prevent giving it in women who have hepatocellular carcinoma, cirrhosis, or who have active hepatitis at the moment. Women with history of hepatitis but which is completely cured, the LFTs are normal, you can give it to them. Apart from that, you have to prevent giving it to women who have any sort of thrombophilia. Thrombophilia is basically high potential for thrombosis, things like lead in 5 mutation, protein CNS deficiency, antithrombin deficiency, or APLA syndrome. Women with SLE and APLA together, all these women have to be avoided being given these pills. Apart from that, women who have breast cancer, especially who have ER/PR status, that is estrogen receptor and progesterone receptor status positive, receptor positive breast cancer, you have to avoid giving it to them. Especially the progesterone component can increase the risk of, or it can increase the recurrence of breast cancer, so you have to avoid giving it in them. Apart from them, which all women can be benefited? What are the risks of, which are the cancers that are reduced in risk by giving this? It includes, first of all, ovarian cancer. How? It prevents ovulation. Now every time there is ovulation, there is going to be on the surface of ovary, there is going to be scarring. Every time there is ovulation, जब ovum निकल जाता है वहाँ से, so वहाँ पे there is a scar that is left behind. Now recurrent scarring can lead to the chances of ovarian epithelial cancer. Now that is going to be reduced by this. So it takes at least 8 to 10 years of consumption to reduce that risk. Apart from that, endometrial hyperplasia is prevented by progesterone, so it reduces the chances of endometrial cancer, type 1 endometrial cancer as well. It also reduces the chances of ovarian cysts by the same method that I just mentioned for ovarian cancer. It is even helpful in women who have a family history of colorectal cancer. So the estrogen is a protective factor for them. So that is it about this. One more question that you can be asked in the exams is, can this be used as an emergency contraceptive? Yes, there is Yuzpe regimen wherein you take 2 tablets together, which can be used as an emergency contraceptive as well. And then that is it about OC pills, oral combined contraceptive pills. I hope this session helped you all, and keep watching this space for more videos on contraception that are coming very soon. Thank you.